And that depends on the different parts of the world. But here in Kenya and most parts of Sub-Saharan Africa, we are seeing the young people being at the highest risk, particularly girls between the ages of 15 years and 24 years. In Kenya, these account for, looking at 2023 statistics, these account for 59% of the new infections.
What do you think is driving that, doctor?
I think the young generation, popularly known here as the Gen Z, did not live through the age when HIV was really a fatal disease, which quickly killed people with the very severe clinical manifestation and complications. And therefore, they seem not to understand that HIV infection is truly a dangerous infection. Number two is because the issues of safe sex has been a big challenge in this area, with the shortage, with severe shortages of condom due to shortage of reduced funding, and also the high taxes that the government has imposed on on these commodities. In addition to this, we are also seeing significant challenges with the disempowerment because of unemployment, and therefore there is a lot of dissolution among this age group.
Amid that crisis in Kenya and other parts of the world, there's still a lot of talk from the United Nations, the UNAIDS and the United Nations aiming to eradicate HIV/AIDS by 2030. How realistic is that goal?
I think it is real in some countries, particularly if we can sustain the AIDS. Because you find that in sub-Saharan countries, most of the countries that are making real good progress, including Kenya, the 80%, almost 80% of the funding towards HIV pandemic response is mainly funded through donors. Big on this is PEPFAR, Global Fund, and other funding organizations that are non-governmental, including AIDS Healthcare Foundation. And with the significant withdrawal of this funding, there is a big threat that the gains that we have seen over the last 40 years, they could start reversing very quickly, because HIV infection is like a wildfire. If you control 90%, like we have in some countries, and you leave 10%, it only takes a wind and maybe a couple of days to get another wildfire running and causing untold damage and loss of life.
Doctor, very quickly, what do you tell someone who comes to your hospital and tells you they are HIV/AIDS positive?
What we advise them that this is, given the current medication and tools that we have, this is a lifelong condition, and they can live a full and productive life with it as long as they remain on treatment. And most of the women are living very positively with this one. But we're having challenges with men, mainly who do not adhere to treatment. And that's where they are accounting to nearly 60% of the mortality that we are seeing now.